Hey everybody, Apocastasis here. I'm going to tell you about how I achieved getting top surgery privately in Melbourne, Australia, and how much it cost. This isn't the only option available, and it certainly isn't the cheapest, it's just how I went about it. I experienced a few hurdles, like my referrals getting lost, so it's important to chase up on your paperwork and triple check everything, but I won't go into that in too much detail. The path I took is reasonably expensive and quite slow, but it was the best option available that I was aware of at the time. Step one for me was talk with my GP. I have a pretty good relationship with her and see her pretty often. I talked to her about what I wanted to do, and she gave me a referral to see a psychiatrist. It has since come to my attention that there are some GPs who will prescribe scripts for HRT without a psychiatric referral. Step 2 was the psychiatrist. My appointments with the psychiatrist were kind of far apart and really expensive, and took a long time to arrange. The initial consult fee was $285 with a Medicare rebate of $212, which left me with an out-of-pocket expense of $73. The ongoing fee per appointment after that was $210 with a rebate of $150, which left me out of pocket $60. After about 9 appointments, I'm not sure how many it was exactly, he gave me a referral to see an endocrinologist with the go-ahead to start testosterone. Each appointment was a few weeks apart. Step 3 was going to the endocrinologist. My endocrinologist is covered by Medicare at a local hospital and bulk bills, which means there is no out-of-pocket expense for me. He wrote me a script for Primatestone Depot, which costs approximately $30 for a 3-month supply. That is a medication which needs to be injected approximately every 3 to 4 weeks. Step 4 was getting health insurance. I got private hospital cover with NIB, which costs approximately $130 per calendar month. You need to be insured for a whole 12 months before you can go to the hospital and claim hospital cover. And it's also quite important to check with your health insurance provider that they will cover the surgery that you are going in for. And the Medicare item number for that is 45520, and you get that times 2. That's for a double mastectomy or mammoplasty unilateral. It's absolutely worth it to be insured if you can afford to wait that 12 months. If you're able to put off surgery for that time, especially if you don't have a lot of money, it's the best option. It gave me time to save up money for step 6, which is the surgery itself, and also was just peace of mind in case there were any complications and I had to stay longer in hospital, which it turned out there weren't any. Step 5 was getting a referral to see the surgeon, so I had to go back to the psychiatrist and express that I was happy with being on testosterone. After another appointment or 2, he was able to give me the go-ahead to see a surgeon for top surgery. It was a prominent Melbourne psychiatrist, and I cannot in good faith recommend him to anyone, I'm afraid. After acquiring the referral to see a surgeon, I was able to get an initial consult with Andrew Ives in March of 2013. I forget how much that initial consult was, but it was probably a few $100s. I eventually booked my surgery for late October 2013. I no longer have to see the psychiatrist, but I do need to see the endocrinologist once or twice a year. Here's a cost breakdown of the surgery procedure itself with health insurance. It was a $300 deposit, $3,000 surgeon's fee, $500 hospital fee, a $25 sundries fee, and a $1,200 anaesthetist fee. About a month later, I received a pathology fee for testing the removed tissue, and the cost for that was $141, and I received $39 back from my health insurance provider. This left me with an end total of roughly $5,130. As for Andrew Ives, I'm happy with my results so far. I'm roughly 6 months post-op. I had no surgical complications. The people at Masada Private Hospital, where I stayed at, were fantastic. I had a private room all to myself, and the staff there were very friendly and understanding. I only had to stay for 1 night. Andrew Ives himself is professional and good-natured, and I'm reasonably happy with my experience so far, although I've got a long way to go still in healing. Immediately following the surgery, I I had drains in for approximately 5 to 6 days, and then I had those removed. And here is a photograph of my chest after 12 days. There's still quite a lot of swelling, and the stitches are quite obvious. And then here is another photo of me after 6 months. I'm hoping with time that some of that tissue under my armpits will go down a bit more, and the scars will hopefully fade as well. I don't have any pre-surgery photos, but my chest was quite large prior to the procedure. And that's all the info that I have. If there are any questions, I will do my best to answer them. Thanks for listening.